Good morning, everybody. I hope you are all doing fantastic. I am Dr. Stacy Livingston with Pinnacle Chiropractic. So, I hope everyone had a happy, safe Independence Day. Nothing too wild or crazy happened. And I hope those of you that won our Trees and Wheat giveaways in the Red, White, and Boom enjoyed the heck out of those. We saw a couple videos of them, and they look pretty awesome. So this morning, I want to talk about HBOT, or hyperbaric oxygen therapy, and traumatic brain injuries. And to keep things somewhat relatively simple, we could divide those into concussions, which there's mild, moderate, severe concussions, and then there's traumatic brain injuries, which there's classification of those as well. But for all intents and purposes, let's just kind of group them together as traumatic brain injuries, which they all are. So HBOT involves breathing pure oxygen in a pressurized environment, which would be the chamber, which increases the oxygen levels within our bloodstream and helps aid in tissue repair and reduces swelling in the brain. While there's a number of studies out there that show promising results in the acute phases of TBI, there have even been some that have explored its use in the chronic stages, and it shows to even help with that. I want to say they studied people 4 years out, and I believe that one's on the International Hyperbaric Association's website. So HBOT helps increase the amount of oxygen in the blood, which can be crucial for brain tissues, as traumatic brain injuries cause swelling, and that swelling causes reduced blood flow within the brain, which leads to oxygen deprivation. So it's kind of a negative feedback loop there when you look at it. So when you increase the oxygen in the bloodstream, it helps reduce inflammation, and HBOT helps reduce swelling within the brain, which is a major factor in helping mitigate the severity of a TBI. HBOT has also been shown to help stimulate the production of what are called nerve growth factors, which are essential for nerve repair and the growth of new blood vessels within the brain. Pretty awesome stuff, which again helps aid in the recovery and the function of the brain. There have been quite a few studies that show that HBOT leads to improvements in cognitive function, motor skills, and emotional well-being in acute and chronic traumatic brain injuries. So that is super, super key here. A lot of times people with TBIs experience behavioral changes. So, it can make a world of difference, especially for those. What we have seen is generally in acute phases, we see people do better at lower pressures. More of the chronic phase tend to be higher pressures, but again, there's a lot of research out there. So, one more quick thing before I hop off of there too. There are things you can do as well to help aid or as an adjunctive or help make the HBOT treatments more exponential. Red light therapy, methylene/lumitol blue, and BPC 157. BPC 157, there's not a ton of research here on it in the United States because it's a natural occurring compound, low protein, and it is body protective compound. If you do find research on it or you're looking for it, look at the stuff coming out of Europe. Super, super awesome. And just as a reminder, everything we do here is to help get you back to where you want to be quicker and living your life. If you have any questions or comments, please drop them in the video below and I will answer them as soon as possible. Have a great day. See ya.